Hello everyone, welcome back. So today we are going to record an episode on a really frequently requested topic, which is postpartum depression. This is something I don't know a ton about, so I was really excited to get a guest for this episode. She's Dr. Susan Karabell, and she's one of the supervisors at the women's clinic in New York, where Kibby actually did her fertility rotation. So Kibby will introduce her more formally in just a second, but especially during this pandemic, I mean, it's really thrown everything into confusion, and pregnancy and motherhood, you know, you'll hear like it has so many unknowns, and to do that in a pandemic is just another layer of anxiety and stress, and so we see it rising right now. And I think more generally, it's an interesting topic for those of us who are approaching the years of motherhood. It's something I hadn't thought a lot about before, but suddenly it's becoming a lot more relevant. And, you know, again, this is one of the times when we just recorded the interview, and I can say that we brought up this point, which is like motherhood is so celebrated, and yet it becomes really obvious that this is it's kind of like a hornet's nest. Like there are so many vulnerability factors here. And so if any of you have experienced postpartum depression, or postpartum anxiety or anything else, and it feels like there's something wrong with you, I don't know, I just thought this was a great episode of her normalizing that experience. So without further ado, I'll let Kibby introduce the guest, and then we'll go in.
This is Dr. Susan Karabell. We're really lucky to have her. She's really revered in our clinic. She's an assistant professor and attending psychiatrist at Weill Cornell. And so I met her through my internship program at Cornell. And she's one of the supervisors in the women's clinic. So that's a rotation I'm doing, and she's one of our attendings. She did a fellowship in women's mental health at Brown University and has been working with women in the perinatal period mostly. So the preconception planning, pregnancy, or postpartum period. So she really specializes in that, but she has broad expertise in a lot of different areas in this population. So thank you so much for coming. This is really an honor for us.
Oh, thank you. Excited to be here.
Yeah.
So just to get us started off, can you tell us what is postpartum depression?
Sure. So postpartum depression is really, many things. So there's no one postpartum depression, which we often talk about in the field. There's a range of, we like to think about things sort of on a continuum from there's postpartum blues to postpartum depression, and then there's postpartum psychosis. So in terms of, I can say a little bit about the postpartum blues. So that's a normal, it can be normal for many women where within the first few days after delivering, because of the rapid shift in hormones. So during pregnancy, our hormones are elevated, but they're pretty stable. And a lot of women have some sensitivity to the shifting of those hormones. And after delivery, they fall very rapidly to almost premenopausal levels. And there's some women who have a vulnerability to those shifts in hormones. So think of women who might have more severe premenstrual symptoms, for example. Those women are increased risk for postpartum depression. So some women may be more vulnerable to those shifts. Just to sort of differentiate, postpartum blues is pretty common. So it's between 50 to 85% of women. It's not something that's impairing. It might be upsetting. So it could be emotional lability. Some women will tell me that they just were not really emotional before, and they will just find themselves crying out of nowhere, can't control their emotions. But it's not something that's impairing their function. It can be sporadic. It usually resolves spontaneously without treatment. So it can happen in the first couple of weeks, but it usually peaks after I guess 5th day of delivery or somewhere in that range. So it's something to be aware of for a lot of women because they may not expect it.
Yeah, I have a friend who was just no one told me about the first 48 hours. I just screamed at my husband for no reason, just screamed. And then they were better. So, yeah.
And, you're not sleeping. Some women have a tougher delivery. And people don't there's traumatic deliveries and whatnot, but but it is something that can be considered in a normal range because it can be so common. Some women who might go on. So sometimes the presence of these symptoms might be a sort of clue that this is something more than just postpartum blues. It could turn into more of a postpartum depression, which these symptoms persist. So if these symptoms are occurring a lot of the time and they're more for 2 weeks or more, and it's not just like tearfulness or irritability, it might have some of the more symptoms of depression. So like loss of interest in things, not bonding with baby, poor concentration, like not being able to sleep when the baby's sleeping. Often you'll see a very agitated kind of picture. So more of a lot of anxiety and like possibly ruminating thoughts, feelings of like guilt and shame, worthlessness. Then that might want to clue you into maybe seek some additional help at that point. And these thoughts persist. They're very atypical. A lot of these women might have already had a prior history of depression. So these are not in what we would call the range of normal, and we would encourage women to seek additional help at that point.
I guess what I'm wondering is, there's this whole cascade of hormones that really seems like a giant vulnerability factor.
Yeah.
But new motherhood also seems like the perfect storm setup for depression in a way. I mean, especially with the sleeplessness, the physical pain. And then, I mean, is there a big cognitive component? I mean, are people often feeling like, oh my God, my life is totally different now, like role adjustment, or regret, like, or is it mostly this huge cascade of emotions that just sort of sets off a depression?
Yes, it's a great question. It's interesting to sometimes kind of break these up into factors, right? So it's like you can think about it. There's like psychological component. There's the biological component. There's so for example, like with the biological component, like sleep would be one of those factors, right? So all of a sudden, like you're not sleeping, like, you might have had some sleep deprivation during the delivery, or feeding the baby every 3 hours, and it takes like an hour to breastfeed. And a lot of women don't know that this is something to expect. And that's in some of the best of cases. So imagine like women who have a baby with like special needs, or the baby might have been preterm. And so those are just some of the factors, like, if a woman is using substances, then there's like a lot of what you refer to, like with this role transition, if we look at psychological factors. So absolutely. So like the shift really happens like when a woman is either planning a pregnancy or becomes pregnant. Like there's just so many psychological changes that happen during that time. So it's like there's a lot of loss and grief associated with becoming a mother, like the grief associated like loss of her previous role as now all of a sudden you're making room for a baby. How is this mom now going to manage like a career and a baby? And how is this relationship going to change with her partner? There's like, oftentimes I feel like most of my patients are also moving around this time, and sometimes it's practical because now you're like maybe getting more space, or really the pandemic has like thrown a whole new, layer of like complication into this whole picture. But so there's a lot of changes that are happening. There might be some like financial considerations if women might not be able to like it's just the change of resources, and you're trying to account for that change of resources. Like some women are worried about like, how am I going to be able to work, and what is all that going to look like? So there's that. And then some of the other psychological factors that come into play in addition to like the role, anticipation of the role transition, is a lot of like you see a lot of trauma histories, and oftentimes like you'll see that maybe someone hasn't like really wanted to think about it much, but they find themselves thinking about it a lot more during pregnancy. So you really see this time of trauma reactivation, which is very, very common. So it's an area of opportunity because I see so many patients where they just will say like they really didn't want to think about this. They didn't think it was productive or whatnot, but now they're just thinking about it so much more, and they want to really prepare for their role as a mom. And They're just more willing to address some of the things that might have happened because it comes up in this shift. People who've maybe lost a parent, that becomes relevant, or have had some difficulties with parents in the past. It's something that might come to the forefront. Just the physical act of delivery is so, such a visceral experience. So with like sexual traumas, that might be something that becomes very relevant and something that women want to talk about. So it really absolutely is the perfect storm in a lot of different ways. And there's just so much unknown. So if someone isn't, if a woman's not really good at managing these unknowns, that it's very, very difficult to control pregnancy, and you're just along for the ride. And there's a lot of ways of intervening and helping the woman. It's also, there's some of it you just are kind of waiting, the months and see what happens. And you're helping women really navigate and become more comfortable with tolerating that uncertainty.
Mm-hmm. There's a couple interesting things that what you said. One that is still staying with me is the idea of the grief and in this transition. I mean, you're just describing like this big, huge life change, like moving, your role, your relationship, your whole body, everything. Mm-hmm. And work in the women's clinic, there's a lot of guilt over, well, I should just be happy. Like everyone around me is just congratulating me and throwing a party and saying, oh, this is amazing. But yet there's a lot of, loss of who I was and what I used to do to make myself feel better. And
That's right.
There's a lot of grief there. So I think it was just really interesting you bring that up, because people might not be as comfortable with those negative feelings about motherhood than the other ones.
To piggyback on that, like it is funny. I mean, kind of what I was mentioning, like I idealize motherhood, but then when you really think about it, I mean, it is so interesting that it's such a period of congratulations and parties and everything, but the bodily changes, both hormonal and the hormones you wouldn't even think about, and body image changes. I mean, that's got to play in here too. And sleeplessness and change of nutrition and changes in substance use. And I'm like,
I think I'm watching you panic about
it. Right. And it's interesting because in the past, we've always been told like, oh, this is just, I mean, it is a transformative time, but you should be really happy. You should be, a lot of people like displace a lot of people have opinions and how a pregnant woman should feel and is supposed to feel. And even though that's changing with a lot of awareness and advocacy, a woman will be like, get a lot of unsolicited feedback and, just all kind of displaced on like maybe based on someone's own sort of views and education, like judgment about things and like their own experiences, not necessarily her experiences. And,
right.
So there's a lot of like mixed feelings, a lot of ambivalence, right? And we try to teach women to really accept some of that ambivalence. So it's okay to have some grief and loss, and it's okay to have some aspects that
it seems so obvious now, and like we're all we ever do is congratulate people, but it seems like a big contingent of just be like, are you okay? Like,
right.
Are you sure you're happy? I don't know.
Right. It's like, how are you feeling? As opposed to, look at you, you look so great and, you put on weight or you haven't put on weight, or why are you so small? Or why are you like, there's like the touching. Some people might not even ask a woman if she feels comfortable, kind of like they just might put her hand on her belly, and family members saying, well, you should just be so happy. This is so exciting. There's, maybe there's people in their life that are dealing with fertility issues. So there's some, that can be a little bit complicated as well. And so there's some negotiation there. So it's like, oh, I should be really happy. I mean, I have so many patients who it was really hard for them to get pregnant, and they did IVF, and then they encounter these mixed feelings and they're confused. They're like, well, I don't understand. I went to this, like I chose this. I worked really hard for this. Like, why am I not more happy? Yeah. And so we really help women accept that that's part of the experience of pregnancy and motherhood in general, is that they're just not always going to be this idealized experience like you're describing. It's not always going to be just wonderful, and it's okay to feel that way, and still kind of work in some of the acknowledging those feelings and helping her adjust as much as possible in like a healthy way that promotes like good bonding. But understanding those feelings and like recognizing those feelings, because that's not the information she's getting from the outside world necessarily.
So even just thinking about this individual experience, and I can imagine with a lot, especially in the pandemic, a lot of mothers are kind of alone in their own experience, right? There's like at home, they're like feeding the baby every few hours. They're kind of, like in their world. And you mentioned a couple of symptoms of postpartum depression, but how would a woman know, or even their loved ones know, if this is just like a normal time that they're so sleep deprived and stressed out and then motherhood is just hard, versus like, I have postpartum depression?
So if it's persistent and it's lasting, we apply this criteria to just regular major depression outside of like the peripartum period, where the woman's just not able to sleep, like she's exhausted, she can't sleep, a lot of anxiety, like suicidal thoughts is never in the range of normal. We should always encourage somebody to receive some like expert treatment or just some kind of help about that. At the very least, like if there's some doubt, you encourage someone to see somebody and to seek expert guidance, because sometimes it's hard to know. And I actually get that experience a lot with a lot of my patients. Is I often see moms who are now seeing me for their second or third pregnancies, and like you get a history of, well, actually like she had a really bad postpartum depression that may have even lasted up to like a year, and they just didn't know how they were supposed to feel. They thought that was part of the mom experience, and so they just didn't seek that help. And there's a lot of like regret, and it's just not how they would have wanted to experience become any mother. But it's exactly what you're saying. I think now with a lot of information out there and available resources, and there's so many programs in place, even for areas where they don't have as much access. Like you don't need to have a peripartum expert. Sometimes you might want to see a primary care doctor or your OB. Actually, at least in New York, we're doing a lot of screening nowadays, like during pregnancy and postpartum. There's screening that happens in the obstetrician's office and the pediatrician's office. So it's just about encouraging people to reach out for that help and ask those questions, and they don't have to become their own expert. They want to tell somebody about it and be connected to some resources. And the goal is to really just treat the person where they're at in terms of what kind of treatment they want. But there are so many resources out there nowadays. So it's about getting connected to the right resources.
So if you're not sure, basically.
Yeah, if someone's not functioning, they don't want to be with their baby. They don't, they're not enjoying, I don't mean like there are moments where they just feel frustrated and want to break for their baby, because that's normal, but it's, there's like an overall difficulty bonding with the baby where it's just not happening. They don't feel like they're adequately able to like take care of the baby. I think it's really important to think about not just postpartum depression, but nowadays, because anxiety is so prevalent and during pregnancy and postpartum, that we kind of lump it in and call it perinatal mood and anxiety disorders. So we really just lump it into one, and you see a lot of OCD type symptoms that emerge around like that time.
Like what? What does that look like?
So actually, it's very common, and oftentimes, like with OCD, sometimes those might while the anxiety might get better, there's some research showing that the OCD might actually persist. But the most common themes are fear of harming the baby, whether it's harm coming to the baby or fear of hurting the baby themselves. There's also contamination fears. So like you'll see women who are excessively washing the bottles or just over-focused on which is interesting now with COVID, of course, because that's really affected this whole thing. But but with thoughts of harming the baby, it's important to mention that that's extremely common. So a lot of research has shown that might happen in 70 to 90% of moms. And very often, so just mentioning it and normalizing it. And of course, you don't want to make any assumptions. You want to ask them questions about it. The key there is because we want to differentiate this from postpartum psychosis with postpartum OCD. So with postpartum psychosis, which can also very commonly involve thoughts of hurting the baby, it's a very different kind of experience. So with women with postpartum OCD, the idea of wanting to hurt their baby is extremely distressing, or it's upsetting. It's not something that they actually think their baby would be better off if they were to do that. And they find a lot of relief. So once you differentiate between postpartum OCD and postpartum psychosis, like a lot of women will find just relief in having someone tell them, you know what, this happens in like 70 to 90% of women. It doesn't mean you're a bad mom. It just, it's just a thought. It's not real. You don't need to, if it's postpartum OCD, you don't want to explore like why that might be happening, because like that can do more damage. It's just how you would treat like an OCD is, just saying it's just a thought. Oftentimes like you'll see a lot of women engaging in these avoidance behaviors, which is, you also want to address those behaviors, because like you'll have some moms who just won't participate in childcare because they're afraid they're going to drop the baby, or they're afraid of, whatever the intrusive thought may be. Or you'll see a lot of these like checking behaviors is very, very common. So sometimes, the monitors can be not a great thing. Or, I've had women who like will sit in the closet and like not sleep and just watch the baby all night and like keep putting their hands on the baby to make sure the baby is breathing. There's something, you'll hear a lot of moms saying like, maybe like they'll check once and they're able to like feel reassured and go back and that's it. But then there's like, it can really develop into a much more, a different kind of place there. So assessing these kind of behaviors, and then if it's not like, if there is no associated behaviors, like normalizing it to some degree. And then if not, then like really helping with some like exposures or treatment. When the thoughts are more like, I think that would be better off for my baby, that's a very different situation. And that is a psychiatric emergency. And that's something that we want to seek immediate care for, bring the mom to like, the ER and get the family involved. So I just want to make sure to differentiate that, because that's something important to keep in mind.
So I had one person reach out over email describing her experience with postpartum bipolar. And she said that she could not, she's tried reading every book, like articles, podcasts, and she hasn't been able to really find any information about this. So it was something she really felt passionate about, getting the word out on this. And it's something I'd never heard of either, but I'll just read you a bit of her email.
Yeah.
She said she welcomed her son into the world in February. He was happy, healthy, and perfect. She says, my first 2 weeks as a mother began with a few blissful days spent doting on my son and searching his tiny, perfect features to similarities to my own. Then everything fell apart. I was hit with a terrifying and my first bout of mania, during which I became convinced that Child Protective Services was trying to take my baby away from me. As a result, I was hospitalized in a psychiatric ward for 6 days, which was nearly as traumatizing as the mania itself. So I just wanted to see if this was something you'd heard of before or seen, or kind of any information about that.
Absolutely. So we know that women with bipolar disorder are very vulnerable during the peripartum, during like pregnancy and postpartum. So while with postpartum depression, as troubling and upsetting the experience can be, we usually say like that can be treated by many different people. With perinatal bipolar disorder, we do recommend someone with like more experience in reproductive psychiatry to be involved in that treatment, just because women with bipolar disorder do tend to have a high rate of relapse, like both during pregnancy and postpartum. The rate of relapse is much higher for women who decide to discontinue their medication. So that really is like a situation that those women should really be watched closely in pregnancy, and particularly in the early, in the postpartum period, because of the sleep deprivation, because of like the hormonal shifts. There's really that can be like a perfect storm. We really recommend women to stay on their medications that keep them well. I'm not going to get too much into the medications, but that's something that you want to be really careful with, because postpartum psychosis, which is one of our psychiatric emergencies, is really primarily something that happens with either a known bipolar disorder, or it's like the onset of a bipolar disorder. So it is it is something that happens like with bipolar, whether it's like a known bipolar patient or someone like a new episode like in the postpartum period. Also, like people with relatives who've had postpartum psychosis are at increased risk. Okay. That's why we want to take this seriously and really screen and make sure there's all eyes, and really involve like the partner and get some additional insight. Like if so while I'm sure it was a very traumatic experience, and we don't want to separate mom from the newborn in many cases. When there is a mania or a psychosis, it's pretty important to get that mom into like a pretty high level of care. Because with postpartum psychosis, it's something that kind of come on very, very quickly in the postpartum period. And there is this increased risk of suicide and infanticide. And while it's itself not a very common occurrence, it's a very serious one, and we have to just really it's a family treatment.
And with I'm so grateful you're bringing these things up, because I imagine even just like thoughts of hurting your child or hurting yourself can be super distressing, right? And women might not feel comfortable saying that to someone or admitting that to their partner or even their doctor. So to know that it is something that's common in postpartum depression, but and depending on what level of risk that is, I think that's up to the professionals to figure out. But that's at least something like, people listening, don't be scared to talk to a provider about that, because it's important. You either get treatment for that.
I mean, we can kind of do separate podcasts on how like there's been sort of racial inequities in the system, where like in some cases maybe that has led us different like outcomes, which like were not necessarily in the best interest of the patient, but for the purposes of of this podcast, like we really do encourage women to seek help and to be straightforward. Then the other thing about postpartum psychosis is it really is very much waxing and waning. So it's like a delirium-like picture. Mm-hmm. So you might have a woman show up to the ER and seem completely fine. And then this happens all the time. But you're like, this is why you really want to speak to the partner and say like, what's happening? Because like they might seem fine, but then they might not be fine like the next time you see her. So it's important to kind of to keep observing and to keep getting information.
Great.
Yeah.
So I just wanted to ask how long these periods typically last.
So it depends. You mean in terms of like depression or psychosis?
I guess all of the above, but especially.
Yeah, it's hard to say. I mean, that's why I think just really being aware of the symptoms and having some kind of intervention is important, because it really can vary. Like some women just don't even seek the treatment, like I mentioned, and they might just get, barely kind of white knuckle it. And, it depends with like we can talk more about the treatments, but it takes time to treat depression sometimes. And postpartum depression can come on quickly and become like very quickly more rapid of like an onset. It can become out of control kind of quickly. So you don't want to be playing catch up. You really want to be more proactive and like, because there's different levels of intervention depending on like how the severity of the illness. So there's a lot of mild cases, there's a lot of like more moderate, there's more severe. So like such as the example that your friend had mentioned, that's more on the severe end. A lot of things won't actually look like that. And so the recovery from that might be a little different. And if we look at long-term data, like there's a lot of really great data to show that women do really well. So like the outcomes are great if you get the treatment and and aggressive with the treatment. It's with just bipolar disorder and like bipolar depression in particular can really be a little difficult to treat and linger a little bit longer. But with the right, usually with bipolar disorder, you need medication. So that can really help fairly quickly with some of the mania symptoms and postpartum psychosis. There's an algorithm that we use based on some research that's come out in recent years. But it depends. It really, like, people have a very variable course, but people, it's just important to be aware. I think oftentimes, like, the fear, I see a lot of women who are so overtaken with the fear of, it's almost like a panic disorder. Like, you worry so much about becoming depressed that they'll spend like the whole pregnancy just worrying about like, what happens if this, and so it's almost like the thinking about it has become like the impairing part, where it is, again, it's like a lot of uncertainty and just reassuring women, and to some degree saying like, their resources are there. If we use the right resources, then people can do really, really well. So while yes, it can be unsettling, like, there are things we can do.
Speaking of that, what are the treatments for postpartum depression, even from psychotherapy or medication standpoint? Like what let's say leading into what if someone does have it and they need to get help?
Yeah, so a lot of times also postpartum depression might start during pregnancy. We call it postpartum depression, but it's not necessarily postpartum. It's oftentimes like, depending, especially if like there's like a kind of stressful situation that someone's going through, or they're having partner issues. There's lots of factors that can contribute to someone being depressed during pregnancy. So it depends. In more mild to moderate, therapy is really the mainstay of treatment. There's different types of therapy that we recommend, and that have shown a lot of evidence. So it also depends on someone's prior psychiatric history and family history. And, like we think about like the genetic vulnerabilities, and whether or not they've been on medication. So in the best possible situation, someone will come in and you'll get to like get that history and have them be stable during pregnancy or before pregnancy. And, in other situations, which is more frequently the case, it's like they've kind of come to you, like they might be coming to you when things have already started to not be going quite so well. And then you're playing catch up. So medications is definitely for severe, for more moderate to severe cases, we recommend starting medication. If a woman has coming into pregnancy who's been on medications, often we'll encourage a woman to stay on a medication. It's a very individualized treatment decision. So it's, one thing I guess, I think we talked about this before, but I wanted to mention, like, women have a when it comes to medications, because of course there's so much fear of like, well, I don't want to take anything that might possibly harm my baby, so I'm just going to try to, do what I can to manage these symptoms. And they might say like, some of this data doesn't apply to me. Like, I'm going to be able to because there's an increased risk of substance use, for example. So someone might say like, well, I think I'm going to be able to like not drink or whatever it is. So it's important to explain to women that we actually have a lot of data showing that presence of anxiety and depression or depression-like illnesses do have an effect on the fetus and do have an effect on the pregnancy. And we have a lot of long-term data. It's a risk analysis, which we say very often. So it's not just like the preferable option is to not be on any medication, but oftentimes that's just not possible. Like, so if someone has, I like to really try to address the stigma with my patients by comparing it to a medical illness, because depression is a medical illness. So if you were to say to someone, okay, so maybe your symptoms are severe, or maybe they have been severe in the past. So like when you've been depressed and we've taken you off your medication in the past, you get really depressed and maybe your job might be at risk, your relationship with your partner might be at risk, like you might become suicidal. Like in those situations, they're more clear about like staying on the medication. But if you were to say to that woman, like, they might have like a very kind of reflexive like response to, what do you mean? Like I have to take a medication? Because like I guess part of the stigma is like we've been taught that like we should be able to control these things, right? But if you think about it as a medical illness, like that's just not the case. Whereas if you tell a woman, well, okay, what if your blood sugar was really high? You had really high blood pressure and you had a chance of, developing these, whatever different, variable like medical sequelae, like they would be much more quick to agree to take those medications. And I like to point out that inconsistency of thinking because people just don't think of psychiatric medications necessarily in some way. So if we talk about it as like this, you're making this decision because this is protective of your pregnancy and of your fetus. And, we want to keep you well. So like whatever it takes to keep you well during pregnancy and postpartum is really the best thing for you and your baby. So we can't separate out you're part of one unit, and what it takes to get you well is going to be what's best for your pregnancy and your baby. And so
do you
it still can be hard. Yeah, sorry, go ahead.
Do you see women feeling as though mental illness is somehow like a personal weakness or failure?
Oh, absolutely.
And then they don't want to choose that over their baby. And so maybe like that might be some resistance to staying on meds.
Absolutely. Like that, I encounter that a lot. And sometimes in the end, like some women just don't feel comfortable. We have to let women make the choice of like, what do you feel comfortable with? And I can strongly recommend, like, I think you should take a medication. If we're talking about depression, particularly if we're talking about bipolar disorder, or even if we're talking to a woman who, is depressed during pregnancy and has developed symptoms, and I would recommend starting medications during pregnancy as opposed to waiting to the postpartum. Like some women just, even if you present the data and like you might not want to do this in one session because information might be overwhelming to them. So maybe you'll give them the information and regroup and have had them like a chance to talk to their partner and like process some of the information and give them some online resources to read over and then revisit the decision. And sometimes it's just seeing somebody through the pregnancy. Like you continue to offer what you think is your advice, but people may or may not, they decide what risks they're willing to take and what they feel is best for them. And that's all you can do. We want to really not further make moms feel badly about certain decisions and just try to give them information in a non-judgmental way.
That's a good point. I'm thinking about what it's like for like the spouses or other loved ones, spouses, mothers, or, the grandmothers or anyone around that can see their loved one, spouse, whatever, suffering from postpartum depression. I'm sure it feels kind of bewildering and like helpless. And I'm wondering, what can they do to help? Like, I'm sure a lot of them are scared to say, hey, I don't think you're doing well, right? Because that could come across as critical or criticizing the way they're being a mother. So what can loved ones do to support? Or
there's a lot of different ways. So one way is like really supporting her in terms of allowing her to get some self-care and sleep. So I think like moms have, like some people have this thing that like, where if they're taking care of themselves, that means they're not being a good mom. So maybe providing them with some opportunities to do that and like sharing some like feeding time, just providing some education. I've had like, so you want to like enlist them and help empower the woman, I would say, as opposed to like making her feel like there's something wrong with her. And sometimes like maybe the mom might, depending on who you are, right? Like maybe the mother-in-law or somebody who like might have like a more loaded relationship, like not the best person necessarily to tell them. Like, I think it's about helping the mom kind of feel safe and seeking help, or, that can be really challenging. Like sometimes, insight really can be variable. Some partners, and it's hard without making generalizations. I don't want to make any generalizations, but sometimes like when you see like in traditional male-female relationship, like, the male might have this, like, it's like, I want to fix it. I want to help. Yes. I want to help her feel better soon. So like in traditional, like heterosexual relationships, sometimes there's that dynamic. It's not always true, but just kind of teaching someone to be more, patient, but it's not about fixing it. It's just about being there and letting her get better at kind of her pace. But there's lots of layers of this, and sometimes the partner might have their own postpartum depression or what have you.
Can men get postpartum depression, or
it's such an interesting question. It's been like an understudied field. There's a lot of people who are out there looking at it and providing that support. Like if there's been such a focus on the woman, and sometimes the men just get ignored, and it's been a little bit harder for various reasons to have like groups, for example, for men and for but sometimes they're not going to have the same hormonal shifts, but you're absolutely still going through a lot of these psychological issues or biological issues as well. Actually, I remember at a conference hearing about, I thought this was so fascinating, how I guess if you image a parent's brain in like that first year postpartum, so the mom's brain will change, and that's understandable because, because of the, whether it's progesterone or estrogen, like they really affect a lot of the neurotransmitter systems. But if you look at a dad's brain, like it would also change postpartum. So it's not, and there's a lot of different types of parent arrangements now. And so, yes, they can absolutely.
Interesting. That's really interesting.
Yeah, there's really cool research out there.
It's funny. I one of my favorite comedians, Mike Birbiglia, has this piece where he's talking about like becoming a father and how hard it was. And he was like, I watched my wife become a mother. She birthed life, and I stayed the same. So, and he was talking about the pain. Like I can imagine for partners, male or female, it is this watching a mother become a mother and not knowing like how much to step in and help. What can I do to support them? And especially postpartum depression, it could look like kind of overwhelming, like, but then what do you do? Do you go in and, tell them to take more self-care, or do you fix things, or do you just let it happen? I'm sure it's like very confusing. Yeah.
And then there's situations where you have postpartum anxiety or OCD, where like you might have somebody that is, because in very traditional, has been like kind of like mom knows how to do things and mom needs to do everything. And that's just not the case in a lot of modern relationships. Like, men are playing as much of a role, and things are a little bit more, the modern household looks very different. Modern parenting looks very different. So that's kind of negotiating that. And like, even though they might view it as like, well, mom's doing the breastfeeding. So like they might not, for example, like for moms who are exclusive breastfeeding, like you really want to get the partner in there as much as possible. And maybe of like having some, whether like doing bottle feeds, because you want the partner to learn how to do it as well. And also because if you have just one parent doing things, like you takes away from the confidence of like the parenting for the other partner. So the more you can get both parents integrated, and it comes like with a whole different negotiation of things, because they might have different visions over what being a parent looks like and what does it mean to raise a child. And they're bringing their own experience into it. And so now you have to negotiate two people's very different experiences of what that should look like. And things become a lot more than about just the baby itself and, feeding and, bathing and taking care of the baby. It becomes like their own kind of father's relationships with their own parents and their own experiences. And so you definitely want to consider the other parent, of course, and increase like, the role that they're playing and have them help and be very much a part of the team.
Mm-hmm. So there is something they could do practically. There is a way to help.
Absolutely. Yeah, absolutely. You might have some resistance. It's a lot of negotiation. It's just negotiation.
Yeah.
Sometimes, it can look very different in a lot of different situations.
Yeah. I remember one paper I read to prepare for, doing this kind of work is it was a very clear connection of social support and support for the mom and risk of postpartum depression. And then we just had, and like culturally that means different things, like the pandemic, that also means different things. So I can imagine just the amount of support a mom has can make a huge difference in the illness and how they recover from it.
Yeah. And just to like kind of back up for a second and then I'll address your question. Like it's important to remind moms because some moms really don't want to give up that control over the baby. They're like, no, they get a little bit protective and saying, you better let your partner learn this because later you're going to regret that. You don't want to be the single caretaker of this child. Like, so there's going to be some compromising taking place over like things maybe not being done the way that they wanted it. And somebody who can identify with that, it's a parent like that's very, very difficult to give that up. So it's kind of learning to like tolerate other types of parenting and like comfort and like safety kind of things, because it's better for the child to have two active parents who are both able to like deliver, be parents in perhaps different ways, but like coming together on that. But in terms of like, yes, 100% you're right. Like the social support, perceived social support is been like really linked with postpartum depression. It's an important factor. I think I saw some recent research that we are seeing higher rates of postpartum depression during the pandemic. And, one association we can come up with is like, there have been fewer supports because people are isolated at home, like their usual families might not be around, their families might not be around, like maybe there's some, one partner might not be comfortable with childcare. There's, we're bringing somebody else into the household. So that's been thrown into the mix. So there's so many different things that have to be negotiated. I'm just repeating myself. That didn't sound very good, but
no, it sounded great.
Yeah, but social support. And so one of the treatments, which is interpersonal therapy, is you're teaching women how to maximize those supports and like how to better navigate a partner relationship with maybe their partner or their mother, because it does take a village to raise a baby. And so you want to help maximize those supports and like mobilize those supports in any way you can.
Well, we usually like to end by asking you for any resources you might recommend to new mothers, to people who want to help new mothers, anything that would be really informative and helpful about postpartum depression.
So Postpartum Support International is a wonderful resource that we have. It has tons of information for both the family and for mom. And there's information, about not just perinatal depression, but also like perinatal loss. So like birth trauma, all sorts of different aspects of it. And there's this wonderful part of it where you can actually find local resources. It's when you first go to the web page, you'll see like the little purple button. So there's also, I believe that they offer, especially during the pandemic, at least, like they were offering perinatal groups. Group therapy is such an important part of treatment. So that's one way to get connected to those local resources. And it's a really easy site to navigate. So the other site that I love is Mass General. It's associated with Harvard. It's womensmentalhealth.org. They have wonderful blog and information about medication and a very accessible way for, whether it's providers or patients or families. And they also have excellent information and it's sorted very well, and they maintain a blog, and there's great links to all these other local resources. So it's just, I would start there, and then there's so many from there. There's, Project Teach in New York. So there's a lot out there. I would start with those, usually give those people those two. Because when I see somebody for a visit, particularly if it's for a medication visit, like it's just, you're not going to go through all the data that you've ever learned for it. You just want to introduce the risks and the benefits. And I'll say, like, you can also kind of look at that for a little bit more information until we next meet.
We're going to put those websites up on our website, just so for anyone listening, if they want to dig into those links, they have access to it.
Thank you so much for coming on and telling us about this topic that now seems totally obvious to me. Why people would have mental health difficulties after pregnancy. And as I said, it was a much requested episode, so we really appreciate you coming on, and I'm sure all of our listeners do as well.
I'm so appreciative of Dr. Karabell joining us. It really did summarize a lot of what I was learning in the women's clinic, and just knowing what postpartum depression is just on its own is huge, getting the word out. So for women who find themselves struggling with depression in those early stages of motherhood, this is not your fault. This is not something that's just like, it might just pass. This is something that it could be an illness. And I think that just to summarize, kind of like those signs of like, when is it a problem versus when it's just like hard time. She mentioned problems sleeping seems to be a big one, but not being able to sleep even when the baby's sleeping, and really that the sleep deprivation really catching up with you. Some more anxiety and more concerns about the baby, and not a lot of checking behavior, and not being able to like separate from the baby and constantly worrying about them. And also OCD, obsessive compulsive disorder, like symptoms. For example, like a looping intrusive thought over and over that they're going to harm the baby, even though they've had no history of hurting someone, or they don't want to, and they feel really distressed by the thought. But if that thought comes up, that's apparently common in postpartum depression. So, and also just not attaching to the baby, not feeling that bond, feeling kind of overwhelmed and struggling with the responsibilities of motherhood. Like everyone would probably struggle with that, but if it's kind of persistent, right? It's, it's lasted a couple weeks or a couple months in that period. That's a sign that go see someone, go talk to your providers, go look for treatment. She mentioned what the treatments are, which medications. That was surprising to me. I know that a lot of mothers are concerned about the risk of taking antidepressants or other kind of psychiatric medications, but it could be very, very helpful. So talk to a psychiatrist about that, as well as psychotherapy, right? Interpersonal therapy is the one that I was training in my internship, and that's very focused on emotions and focusing on really processing your role transition and grief and loss that comes with that. So, but I think a lot of cognitive behavioral therapies or good therapies for depression in general could be helpful.
It's nice to know that there are these fertility clinics, women's clinics, that really specialize in this. So, I mean, normally, like when we talk about how to direct people to therapy, it can be kind of a difficult question to answer. But this one, I kind of feels like there might be some guideposts here. I mean, there are these actual clinics that are suited exactly for this.
Yeah, there are. And asking your OBGYN, asking your primary care doctor, or just looking at the resources that Dr. Karabell gave us would be helpful. So get help is what we're saying. Get help if you feel like motherhood is overwhelming. And for the loved ones, I mean, to know that it is an illness, and not just sitting with it and just suffering in silence, but knowing that this is a disorder, this is an illness that can be treated. It seems like, if loved ones want something really practical to do, is like support the mother in the responsibilities and let her do some self-care, right? Really what she said was promoting the idea that self-care is not selfish or being a bad mother. But I've said to patients, it's like putting on your oxygen mask before you put it on your child. If the mother is not doing well and not taking care of herself, it can be harder to be the best mom that she can be. So to kind of destigmatize that and find ways to support the mother so she can take care of herself.
Yeah, I've read a lot of research suggesting that depressed mothers, that is a big vulnerability factor for the child then later having mental health symptoms. So it is important actually to take care of yourself as the mother and try to keep yourself mentally healthy. And I liked how she brought in attachment here, how this does affect bonding, which can then later affect attachment styles. I don't want to edge towards like terrifying depressed mothers or mothers who are in this postpartum period. On one hand, I really just like want to normalize it. Like of course this is going to be a tough time. And, yet there's so much shame associated with having this massive change in your life and not being able to just welcome it with totally open arms and just know what to do from day one. I mean, it's kind of ridiculous, the expectations we have from others. So it completely makes sense that this would happen.
Yeah.
So really, I guess that's a plea to normalize and then take care of yourself. And I also liked what she said about consider your role. If you're the mother-in-law, maybe that's not the best person to suggest treatment.
Yeah, doing it in a way that's not judgmental and not saying you're not doing well, because mothers are so hard on themselves naturally. So, for loved ones to find ways to validate their emotions and mention that there could be ways to help and to support them in that way, instead of, giving them advice of, I heard a podcast and now you're depressed, you need to get help. Empowering the mother with the choice of getting help for herself.
Yeah, I guess that is just one more thing I wanted to follow up on. As she was saying earlier, people give a lot of tips and advice, and this is something that seems to be a double edge in a lot of things. People wanting to give their tips, even, I think I've heard this in people who are going through chemotherapy, people keep wanting to give them tips for how to be healthier, and that of course can feel enormously invalidating. Again, we talked about this infertility, giving tips about how to increase your fertility. I can see why it's tempting though, if you've already had a kid and maybe you went through something similar, to be like, get this product, do this thing, because it is such a period of such unknown. So when do you know when to do that and when not to do that?
Yeah, it is really hard. I think that leaning on the validation first and the support first before giving advice is important, right? Just to say, I see you're struggling. This is really hard. You feel really exhausted, feel burnt out. You feel like you can't connect with baby. Would you like some help with, this might be postpartum depression. Is there a way that we could kind of tell the doctor about it, or maybe to see if there's any ways that we can make this, make it feel better for you? What ways are you open to? Just maybe not advice giving, but mentioning what they see and the care and love, and then open up to what would you like? What kind of help would you be open to?
Awesome. Alrighty, well, I hope you all enjoyed this episode, and we will see you again next week. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.